What's up, guys? We're Kinetic Impact. I'm Dr. Kevin, physical therapist.
I'm Dr. Donald, chiropractor.
I'm Dr. Ben, chiropractor.
Today we want to talk to you guys a little bit about the difference between PT and chiropractic. So we get this question a lot because we have a clinic that has all of us in it, and people ask, what's the difference? So I'm going to start with the lone man in the room, which is the PT over there.
Yeah, so physical therapy, we primarily do rehab, and we work in many different settings. We could go from sports, orthopedics, geriatrics, pediatrics, and neuro. And commonly we also see them in hospitals where we can work bedside and long-term acute care. So we work in different fields in medical and not just purely orthopedics and sports, where that's where most people get the conceived notion that we only do orthopedics.
And what do you think about what we do, chiropractic? How does that come across and compare to what you just said?
Yeah, it's hard because how we view chiropractic and PT, it's such a similar practice because we can do a lot of the same things. Our scope of practice is quite similar, and a lot of people think of like exercise or maybe E-stim and like massage ultrasound when it comes to PT, and then if you think of chiro, a lot of people just think of like the cracks, I'm going to crack your back, and that's about it. However, I think there's a lot more overlap, and I know that a lot of people don't necessarily think of chiropractors as exercise based, but I think that is shifting, and I think a part of what I want you guys to get out of this is kind of how to find a really good clinician, whether they be a PT or a chiro. And I think that's important because if you walk into a PT clinic, I think you could say this, and you've probably witnessed it more than myself, but if you just kind of see people like laying on the table, getting E-stim, getting passive modalities, and then being passed off to aides and not really seeing the clinician one-on-one, that's a PT clinic you want to stay away from. And like on the other hand, for chiro, this is something we've seen a lot of. If you don't spend enough time with the clinician, if you only see them for like 2 minutes and essentially what they give you is a crack of the back and then throw you on a table that massages you and makes you feel good, then I think you owe yourself to find a better clinician that's going to spend the time with you and consult with you. But yeah, I guess that's where I stand. I went a little different route, but they should be similar, but unfortunately they're not, and I think it's important for you to understand so you can understand how to find like a really good clinician.
Yeah, I think like what you're talking about for both you guys is like the traditional roles of what people think of when they think of a clinician that's going to work in the musculoskeletal field. So typically a chiropractor, you're not going to see him in like a bedside situation. Very rarely is he going to be in a hospital or that situation. Most of the time a chiropractor is going to have his own clinic or his own place. They don't typically work hand in hand with like medical doctors the way they should. And then there's a few licensing differences. Chiropractors do have the ability to write MRIs. They are considered primary care physicians. However, I think the point that we're trying to bring up and come across is if you're looking in the field for somebody, and let's just say a clinician, for like long-standing pain, like you've been experiencing back pain, knee pain, hip pain, an ACL injury, which again is going to come across as knee pain. What you're looking for is a person that you can't tell what their role is. So I've been in situations where some of the best rehab exercises that I have learned have come from strength and conditioning coaches. By taking some of those principles and applying them to my patient, because I'll have this person that's been having chronic low back pain, and I realize they have very low force production or the ability to generate speed or power from like their hips or from the ground. But again, if you saw me working with somebody in that capacity in the exercise I chose to do, you wouldn't be like, that's a chiropractic exercise or that's a physical therapist exercise. So it's kind of understanding the world of musculoskeletal issues and then knowing that there's not always one clinician that's out there. It's finding a clinician that adopts the body as a whole and adopts these concepts as a whole. Because what you're not going to see is a dichotomy of I'm going to be able to find this exercise and call it this versus a chiropractic, physical therapy, or strength and conditioning exercise. It's the application of the concepts and tools that make somebody really good.
And I think it's important to realize that physical therapy and or chiropractic, those are professions. Those aren't modalities or interventions or treatments. Those are just the professions in which the means we got our education, and how we apply them. I think that's what you're touching on. How we apply them makes us unique as clinicians, from person to person. However, I think that there should be a much more blend of what people view as each quote-unquote profession.
Yeah.
Right?
How do you think that would happen?
And I don't think we should always just pigeonhole like the profession with you're a chiro or you're a PT or you're a strength coach. We're more of a rehab professionals where we integrate everything that we learn and apply that to the person in front of us where N equals 1, you know? Try to use the evidence-informed information that we learn and apply that towards the person. So I think that's what every rehab professional should be doing.
And I think there's so much to learn in between professions too, right? Like you guys have such a great opportunity to learn in the hospital system and post-op, like some very fresh stuff that, like Dr. Ben was saying, like typically what chiros do is we just hang up our shingle and we start practice, and we see a lot of like chronic. Start cracking backs, yeah. We see a lot of persistent pain or like reoccurring pain, but like not a whole lot of post-op. You know, not a whole lot of those populations that are in the hospital system. Yeah. So it's good to learn from each profession.
Yeah, and before I progress, I also don't want to downplay the importance of manual therapy in care and what it does for patient confidence levels, the ability it can get somebody to feel better, even if it's not addressing that immediate problem. For example, let's say someone's had chronic low back pain and you realize there's a lot of hip dysfunction, and you're not typically going in there and it's like, this is going to be a 90-day timeline where we're going to be looking for changes to the physiology over this time period to create long-lasting results. There is a lot of value if somebody's coming in and they're in some pain and you have the ability to do any number of manual therapy techniques, whether it's a chiropractic manipulation or a soft tissue or something with a cup or poke them with a needle, whatever you want to do, and it makes that person feel better. That right there can help, A, get the person to feel better, which is important, but B, create an opportunity for buy-in. And Kevin, I'm going to turn this back over to you, having worked and integrated into our office and seeing several things. So there's one thing, I think, a question that is always asked by me, because the world views us differently, right? The world doesn't walk in and go, chiropractor that does rehab. The world walks in and go, this guy should be able to crack my back and that's why I'm here to get fixed. And then physical therapy, their experience with you is going to be how the public sees you guys. Like, I'm going to come in here and I'm expected to leave with a sheet of paper that has like a band,
3 sets of 10.
Yeah, and this is what you're going to do, and that's going to make me better. And it's like, okay, cool. So that's kind of like what the world expects when they come in and see us. And that's why if you just care about your patient, you have a patient-centered approach, and you apply something that isn't a sheet of paper or an adjustment to a long-lasting issue that's been there for a long time, you can see some really, really good results. However, to backtrack for the clinicians like us that are trying to create this patient-centered approach, they're trying to use the rehab modality as the force that's going forward, that's lifting weights versus bands, there needs to be a conversation between the expectation of the patient and what's going to go down in that visit, right? Or else you're going to end up with mixed signals. If someone's coming in to get their neck adjusted and they leave with a series of overhead presses or whatever it is, they're like, they might not be happy, right? So communication with the patient is really, really important as we start to kind of bridge the gap between our two professions, and then really drop the guys. Like, there isn't really a name that you need to have. It's really like, what is the approach here? How are you trying to get this better? And then what outcome measures are we all going to agree, hey, there's some objective measures here that we're using to be able to get this person better. And chiropractor can do it, a physical therapist can do it, a strength and conditioning coach can do it. You could do it at home, depending on what it is.
Last thing, real quick, I want to turn it to you guys. What would be some quick advice to give somebody that's looking for care, and they're in pain and they're looking for care and unsure which PT or chiropractic or clinic to choose, what are some things to look for?
I think there's a couple of things to look for sure, depending on their activity level. If there's someone that's more active, want to get back into a more active based lifestyle, I think that's where you seek somebody that understands the demands of physical activity. Like, do they have a background in strength conditioning? Do they have a mindset of getting you active and then progressively challenging you to meet the physical demands, getting you physically prepared to meet that demand? So I think that's where a lot of downfall with PTs or even chiros, they underload the patients and don't prepare them enough over the duration of time to build their capacity to meet those tolerances. And that's where it comes that rehab purgatory where they go back too fast too soon, or they go back too early not prepared. And that's very common, I think, in both fields where we both see.
Yeah, I think if I was a patient and I was experiencing chronic pain, something that's been going on for like a number of years, and I've tried several different things, one question that I would ask the clinician or the practice where I'm going, how much time does that person spend with me typically per visit? How much time does that person spend with me for an initial visit? And that's something that's going to be really, really important, because that's going to gauge how that conversation is going to go. So we usually are an hour, and sometimes those will go over to an hour and a half, because there's a rich history there, right? Like, you've had multiple areas that are bothering you. Most people have several things going on, right? So we need to be able to hear what's going on with you. How much time you spend talking in an office is really, really important. If you go into an office and it's 90% of the doctor telling you what's wrong with you and 10% of you telling the doctor what's wrong with you, you might be in a situation to where the standard of care is going to be heavy centric based on what that doctor thinks, right? We want to remove egos. Collaboration, yeah, because there might be an exercise that seems to work for a lot of people, and I'm like, well, let's try this series of motions that has great results, and we try it out with you, and it doesn't. It has the opposite effect, right? So things don't go perfectly. That's really, really good information. That's not like give up and don't keep coming. That's like, now we know where you're at. Okay, this thing that we did to try to correct this issue, this might be something different. Or we got too much going in at one time. So those are kind of the things that I would think about if I'm a patient, what that experience is going to be. So if you're being sold on something over and over and over again, that's a time for you to kind of move away. If you feel like every time you're being sold these goods on this service and it's not getting better, think about the clinician you're working with. Find someone that will answer the question. And also, if a clinician says this to you, I don't know exactly what this process is going to be, but here's the general outline, that's usually a good sign.
And I want to add, finding a clinician that actually listens to you, and actually understands your story and understand your experiences, because everything's valuable when the client tells you something. Those information help you piece the profile together, understanding where they're at and where they need to go. And then I think that's very valuable of what we do here.
Yeah, agreed. I think that's a common story that we hear people say is they don't feel heard. They feel like they're getting the same thing over again despite giving feedback, or they don't ever get a chance to give feedback. So I think those are important things. With that, I don't really have any other things to add.
I want to add one more, backtracking to what Dr. Ben was saying. We try to be more transformative rather than transactional. We try to create value for the clients rather than trying to sell them versus making a transaction every single time. How are we providing value each session, improving their lived experience?
Yeah. I mean, shoot, if we're talking about what we do, let's get into it. For us, like, what's important is that human value, right? Like, we put people over profit. We reach out personally. We create a relationship because we understand that this is a scary time, a frustrating time. Like, it sucks to have limits in what you want to do. So it's our job to help you along the way. And for us, like, the important thing is guiding. So we stay open. We spend the time with you, and we give feedback, and we take feedback from you. And for us, it's a collaborative effort. So if you're in the San Diego area.
And then one other thing to be aware of too is, like, the longer standing that an issue's occurred within you or within your body, just realize like it's probably not going to be like a magical moment that day. And if you're able to come into an office and they're able to create change with you hands-on and it's long-lasting, that's awesome. And I've seen that happen. You know, you get to where it acts like that. But usually making sure that your expectation is good, that you're also given a timeline that makes sense, right? If someone says, oh yeah, we need to see you for like 6 visits and this is going to clear up, you know, and you've been having long-lasting discomfort and it's just come here for 3 to 5 minutes, that's all you need, right? Like a quick adjustment, and this is going to clear this whole problem up over a short time period. I want you to consider that, right? Like that doesn't make perfect sense. Also, too, if you're not experiencing like a fracture, if you're not having any possible bony issues, an X-ray may not be something that they need to have, right? To look inside your body for any particular reason. So things to think about if things don't make sense to you moving forward, and the clinician's answer is always like the same response, oh, this is this.
I think what you're saying is if you go to a chiro and the first thing they do without knowing anything is like, all right, we got to take these x-rays that we give everybody, don't go to that chiro.
I didn't exactly say that.
But I wanted to.
Yeah, I mean...
And then you put them on a package for life, right? After you x-ray them?
Well, yeah, because there's going to be 4 steps of degenerative change, and as soon as I start manipulating your facet joints over time, I'm clearly either going to stop it or possibly reverse it. And the way that we're going to know this is I'll never take pictures of you.
Oh man, yeah.
Again,
don't go to that chiro.
What was the main point of this conversation?
The difference between, I know, we were going on a rant, but the difference of chiro and PT, and finding a good chiro and PT.
I think at the end we realized that most of us we do the same thing. You know, especially you go to a good chiro, a good PT, or I don't know what considered good is, but you go to one of these guys and they treat you as an individual and challenge you. I think that's what somebody usually look for these days.
Absolutely, absolutely. So if you guys have any questions, feel free to email us at info@kirehab.com. Shoot us a DM on Instagram. I think it says @Kinetic Impact. And shoot, we'll be happy to get back to you. And I don't know what else to say. Yeah. I'll see you next time.
That sounds good.
Thank you for tuning into Kinetic Impact.
That's right.